The Ministry of Health has implemented several measures to combat the spread of the virus, including strengthened surveillance, isolation of cases, and contact tracing.
On August 14, 2024, the World Health Organization officially declared Mpox, formerly known as monkeypox, a public health emergency of international concern following the identification of a new highly transmissible strain, Clade 1, which can cause more severe illness. The emergence and rapid spread of a new strain, Clade 1b, in the Democratic Republic of the Congo, which reports 90% of the cases, and the neighboring countries of Rwanda, Uganda, Kenya, and Burundi are the most affected by the reported Mpox cases. This declaration underscores the urgent need for global attention and coordinated action to combat the spread of the virus. The Ministry of Health, Wellness and Elderly Affairs took a proactive approach to put the necessary coordinated systems in place to facilitate strengthened surveillance, early detection and management of possible cases.
The ministry is also working to increase testing capacity and ensure that health institutions are prepared to manage potential cases.
Strengthened surveillance at every level is important to rapidly identify any cases coming into the country from all levels. This includes at the ports of entry, into hotel accommodations, schools, workplaces, and communities. This will allow early identification of cases and clusters to provide optimal clinical care, the isolation of cases to reduce further transmission, contact tracing, and the identification and protection of high-risk groups. Mpox health sector preparation has commenced the sensitization of healthcare workers from the public and private sector, which was done on Wednesday, August 21, 2024. This training continues at the level of the various health facilities. The medication stock at central procurement has been reviewed and the necessary procurement is underway. All health institutions are working on ensuring conditions are in place to manage possible cases. Saint Lucia has the capacity for Mpox testing by the detection of viral DNA by polymerase chain reaction. Clinicians have been updated on the testing protocol and the present testing capacity is being increased at this time.
While mass vaccination is not recommended at this time, the ministry is working to acquire vaccines for close contacts of cases and travelers to affected areas.
This week, the public health officials will be sensitizing key stakeholders on the necessary protocols. These include the Saint Lucia ANC Ports Authority, tourism sector, and the education sector. Protocols have been developed for those sectors and workplaces. There are 2 Mpox vaccines that have been approved by the WHO listed national regulatory authorities. Mass vaccination is not recommended at this time. Vaccination is indicated for close contacts of cases and travelers to the affected areas of Africa. Public health authorities are working with the regional agencies to acquire vaccines in country. Currently, there are no Mpox vaccines in country or the region. The Health Education and Communication units have completed the Mpox communication plan. This risk communication plan serves to promote the dissemination of information, public health messages to the general public to educate the target populations on prevention measures and improve early recognition, reporting, and prompt treatment of cases.
The Ministry of Health is urging the public to be aware of the symptoms of Mpox and to seek medical attention if they experience any. Joachim de Plessis, HTS News Force.